Hello everyone, this is Carlo, the physiotherapist with results. I welcome you to the second episode of my series on manual therapy, which is captioned Manual Therapy in 2025, a solution or a scam. And we've done the first episode where we established the origin of manual therapy and how it works. So basically, a lot of people are being scammed with manual therapy on daily basis, and we want to stop this. If people have pain, they shouldn't go through more pain. They shouldn't die because of manual therapy. And in this series, we establish some evidence about supporting manual therapy and those against manual therapy, and then we'll look at holistically what is the best practice as it regards the use of manual therapy for treating patients. So if you are a client that you're feeling pain and you are contemplating whether to choose manual therapy or to choose other treatment approaches, there is an answer for you today. And if you have been scammed in the past with manual therapy, here we are today. We'll basically establish what works and what doesn't work. Follow me closely, and if you've not watched the first episode, please check up there and click on the link to watch the first episode. Here we go. So before we dive deep into what works and what doesn't work, let's look at why people even seek manual therapy as a treatment. Usually, it is because of pain. It could be back pain, neck pain, knee pain, joint pain, muscle pain, and all of that. And this is musculoskeletal injury. That is when there is a discomfort of the joint, bones, ligaments, muscles, and other aspects of the musculoskeletal system. And this could be as a result of overuse. It could be because of strain, and it could be because of traumatic impact. And in all, we can classify the injury as caused by micro trauma or macro trauma. Micro trauma in the sense that there is accumulation of little stress and strain on the musculoskeletal system over time, and because of that, it results to injury. And macro trauma in the sense that there is an actual impact. Maybe someone fell down or someone have dislocation and all of that. That could be that could result in an injury of the musculoskeletal system. And of course, there are also degenerative injuries to the musculoskeletal system, and the body itself could release some destructive substances that would basically injure the musculoskeletal system, where you have autoimmune diseases and all of that. Now, in all these injuries to the musculoskeletal system, there is a process that goes on, which is we have the inflammation, where you have redness, swelling, and you have tenderness. There is pain, and around that area where the injury occurred, there are nerve endings that communicate between body parts to the brain, and these nerve endings send signal to the brain, telling the brain that there is an injury somewhere going on. And when the brain perceives this, it interprets it as pain, and that is the pain we feel when we have musculoskeletal injury. And this injury can persist, inflammation resolve within a short period of time, and everything is solved and one is fine. It could also be a very persist over a long period of time, and that would result to a chronic type of musculoskeletal injury, a chronic type of pain. And these are the reason why people go from one doctor to the other, and they end up at the physiotherapist clinic, or the chiropractor's clinic, or the osteopath clinic. However it is, whosoever you meet, on the long run, you end up getting manual therapy as a treatment or part of the treatment. Now, the thing is this is where the scam lies. The scam lies in the fact that research has shown that when there is a musculoskeletal injury, the manual therapy is not enough to solve it, because there is need for exercises to strengthen the muscles, to make the joints more flexible. There is need for psychosocial input. there is need for behavioral input whereby you have to change your posture, you have to change some behavior. Maybe the person is overweight, you want to change the diet and all of that. So there is a lot that goes into treating a musculoskeletal injury, and this varies from one individual to the other depending on the unique condition. Now, what these scammers do is they offer you only manual therapy. They just shift your joints and crack it, and they say they have adjusted it and your pain is gone and all of that. And if you're truthful to yourself, with manual therapy alone, you may not get actual healing of the part. If it is even done aggressively, it can result to an injury. So what works, what doesn't work with manual therapy? For manual therapy to be beneficial, both in the immediate and on the long run, it must be used in combination with other treatment approaches such as exercises, cognitive behavioral therapy or psychosocial input. Sometimes dietary input could be very important, as well as quality health education, considering postural changes, lifestyle changes, and several other aspects of care that goes into solving a musculoskeletal injury or treating a musculoskeletal pain. So one other thing that is very important is the milder the manual therapy, the better it is. The most aggressive manual therapy are very dangerous and should be avoided, because the more aggressive it is, the more the force being impacted on the spine, the more prone to injury. So one thing we should note is everyone is not the same. So different clients, different specification, different presentation, even if it is the same condition. So there should be a holistic approach to treatment that involves a package of care that will benefit that client, not manual therapy as a standalone adjustment of the neck, of the back, or any other part of the body. So for it to be beneficial, it must be used in combination with other treatment approaches. This is how manual therapy works. And research have also shown, and experts support, that collaboration among different health experts produce more results than working in isolation. Which means when you have your back pain and you have one guy somewhere his job is to stand on your spine, and he has given you treatment session by standing on your spine, and that is all they do for you. Or twist your neck, try to give you some crack, then they are doing it wrongly for you, and you really want to consider your safety as it regards manual therapy. So let's look at a situation where someone is suffering from back pain, neck pain, or even osteoarthritis. According to the NICE guideline, that is the National Institute for Health and Care Excellence, which is one of the most reputable bodies that provides clinical guidelines for different treatments across the health profession. Now, NICE said that in the cases of musculoskeletal injuries, neck pain, back pain, osteoarthritis, and related pains, it is advised that treatment includes a package of treatment that involve exercises, that involve psychosocial input, that involve education, and then some form of manual therapy, especially the mild one, not really the very aggressive one. And this is to say that, and it was also stated clearly by NICE that manual therapy should not be used as a standalone treatment. So this further buttresses the point of what works and what doesn't work. So if you're therapist is not following this recommendation that has been reached or arrived at by research and different experts coming together to agree that this is how this will be done for it to work, if your therapist doesn't follow that method and they are offering you just manual therapy as a standalone treatment, then you really want to question them, you really want to think twice, and you really want to be more careful about your life. Because as I said earlier, which I will keep saying, a lot of people have died and suffered serious injuries because of manual therapy adjustment, chiropractic adjustment, physical therapists trying to perform different manipulation techniques, thereby injuring their clients. So this is not limited to any profession, and this is across board. Manual therapy should be used in line with other treatment procedures. All right, let's look at what research has to say about the effectiveness of manual therapy. Now, one of my most favorite research papers is the one I saw published on the Journal of Osteopathic Medicine this year, 2025. In February 18th, 2025, it was published. This paper was led by Felipe and several other authors. So it's Felipe et al. 2025. And the research paper is looking at the effect of different level of forces from spinal manipulation on oxidative stress biomarkers, as well as the indicators of inflammation resolution. Now, that is grammar. Let's look at what these authors were basically trying to check. Oxidative stress biomarkers, which are substances in the body that indicate pain, right? And oxidative stress generally. Now, they were also interested in those substances that shows that the body is healing, which is things like resolving and related biomarkers that shows that inflammation have started to resolve, right? Now, in their research, they want to use those biomarkers as a direct parameters to measure the impact or effectiveness of manual therapy, especially when it is applied to the spine. Their finding will blow your mind. Now, they found that in the case of 400 Newton watt of force, when applied through manipulative therapy of the spine, there was positive effect. That means the oxidative biomarkers decreased, which means pain was relieved. Now, in the case of 800 Newton, there was increase in oxidants. That means there was increase in pain. There was reduction in resolvins, which means inflammation increased. So there is increase in inflammation, there is increase in pain, which directly I can say there is increase in injury. From what we've explained earlier, there is increase in injury. So, which means the more the force, the less beneficial manual therapy becomes. So this points me to the fact that if you're going for manual therapy, make sure it is the mild type, right? At this level, it should be the mild. Now, if you're going for a very aggressive one, then you're just risking with your life. Because, for instance, some people stand on other people's spine and they say they are treating them. They stand on your back. Let's say someone that has osteoporosis, if a therapist stands on your back, they can rupture your spine, your vertebrae, and that could basically lead to spinal cord injury, and that can result to instant death or death thereafter. Also, when your neck is aggressively twisted, it can result to, rupture of the arteries that sends blood to the brain. And that way, it could be stroke and instant death. It could result to fracture of the bones in the neck, and that could result to spinal cord injury and paralysis. So there are several things that can come from this, and this research is basically supporting the ideology. Another important research is titled "The Effective Treatment Options for Musculoskeletal Pain in Primary Care, a systematic review of current evidence." Now, this was a research conducted by Babatunde Ukpeyemi and co-authors. Now, it was done in Kelly University, and this was more like a collaboration between the Arthritis Research UK Primary Care Center and Research Institute for Primary Care and Health Science, Kelly University in the United Kingdom. This research tried to look at different treatment options for musculoskeletal pain and compare which are more effective, among the treatment options available in the primary care system. Now, the finding of this research is that as it regards manipulative therapy, massage and mobilization, which are manual therapy approaches, the evidence available is moderate. Then with regards to exercise, psychosocial approaches to treatment, the evidence available is moderate to strong, which means that in a situation where exercise and psychosocial therapy is given to a client, there is expected to be more improvement based on evidences in research, whereas for manual therapy, the evidence is not that strong, right? Which means first option and backbone of treatment package for people with musculoskeletal injury should not focus on manual therapy as the go-to treatment. Rather, manual therapy should be used as an adjunct, and this is actually in line with everything we've been talking about, starting from the NICE guideline and every ideology I have tried to push in this particular episode. So exercise is superior, especially when combined with psychosocial treatment compared to manual therapy. However, manual therapy is also an option and should be used as an adjunct. So this has been a very long episode to say, and I'm glad we've been able to cover what works and what doesn't work as it regards manual therapy. We've been able to use research-based evidence to establish the truths about manual therapy. Right now, the next thing we are going to do in the next episode is we would look at the various myths around manual therapy, what people believe that are not true, and what people practice that are not true. So this will further open our eyes to the lies and the clinical scam and blunders which people commit on daily basis, claiming that they are offering manual therapy and all of that. And this will be coming from research-based, grant, from really reputable experts. Yeah, basically. So see you in the next episode. Stay tuned. This is the deep dive with Physio-Carlo, where we learn everything health, everything physical therapy, everything alternative medicine. Yeah, stay tuned. Bye bye. Please subscribe and follow me, and share this with your friends and colleagues. Thank you.